Cancer Guidance by Type, Part 16. Dr. Dilip Gadgil, Pune. Breast cancer. If lumps or knots in the breast can be felt by hand, it is recommended that you get it checked immediately by a doctor without hesitating or feeling shy. Once you consult a doctor, you will be advised to do FNOC, sonography, and biopsy, if required. And then, modern treatments like surgery, chemotherapy, and radiation will be given. Always consult the doctor before doing FNOC or a biopsy. It is important to ask whether treatments like surgery, chemotherapy, or radiation are feasible options if the disease has been diagnosed in the later stages of one's life. Only then should you go ahead with the biopsy or FNOC. People generally do all of this and then turn towards Ayurveda in the last few stages of their disease. Another important thing to keep in mind is the ER, PR, and HER2 markers, which can help assess the extent of damage breast cancer has caused. In India, most doctors will not tell you about CA 15.3, which is another marker for breast cancer. When this test is done multiple times, it is possible to analyze the exact status of the disease and whether the cancer markers have increased or decreased. However, since one single test doesn't reveal the complete picture, most doctors don't suggest this test in India. It does happen overseas, though. The CA125 test should also be done if there is an imbalance in this equation, ER and PR positive, HER2 negative. Doctors might not tell you about this initially, but suggest doing it later. However, doing it right in the beginning is better. Before starting any type of treatment, conducting a full-body PET and CT scan is recommended. In case the disease has spread to multiple parts of the body, operating on only one specific part won't help. This fact is often ignored, and in most cases, the surgery is done in a hurry, even before PET or CT scans are done. There was a 72-year-old lady who used to come to me for treatment. She had a knot in her breast and complained of acute backache. The doctors at a big hospital had advised her to get operated on. However, I suggested doing a bone scan, which reveals if cancer has spread to the bone. The knot wasn't too big in size, so it was easy to remove it via surgery. But simply removing the tumor wasn't going to help because cancer had spread to her bones. So, we decided against the surgery. I continued treating her for the next 2 years and she lived a good, happy life. The point here is that making the right decisions at the right time is critical in such cases. Thinking holistically and avoiding knee-jerk reactions is very important. When breast cancer is diagnosed at a very young age, sometimes even before the girl gets married, the mental shock it can deliver is massive. A huge reason behind this is heredity. There was a combination called EP40, which helped figure out if you were pregnant. It led to a lot of chaos.